Hi, let's cover bowel and bladder programs. This is one of those things that you know it as one thing, but then on the other side of practice, it is the same thing, but it has a different form or structure or a different name. So that is one of those things. As I talk about it, you understand what I mean. So bowel and bladder programs are individualized care plans that are designed to help manage incontinence in patients. It helps to promote urinary and bladder continence. It helps to prevent complications such as skin breakdown, UTIs, constipation, fecal impaction, all those things that have to do with voiding and emptying of bowels. So that is what the bladder and bowel programs are targeted towards. Back home, nurses assist with patient voiding, bowel movements, enemas, catheterization, diet advice, all these things that help with proper voiding and bowel movements. And they are done, the difference between back home and this place is that back home they are done as individualized tasks, for the patients. But here, the bowel and bladder programs are organized, structured, deliberate, and goal-driven. So they are tailored to individual patients' need, and they are monitored and they are measured. So when you give care, whatever it is you do, if it's giving a medication for the patient to have bowel movement or to void well, diet, fluid management, everything you do, you target, like for each patient, there's a set of goals that should be met in the patient's bowel and bladder program. So those goals are itemized, they are implemented, and they are evaluated and documented. So it is deliberate, it is followed up on, it is measured. So that's the difference between how it is done here and how it is done back home. So the patients who benefit from this are mostly patients with spinal cord injury, patients who are incontinent, post-op patients, patients with neurogenic conditions, patients with one problem or the other that makes them unable to void or have a bowel movement, or makes them to have incontinence in both. So components of this bowel program is medications. Of course, you give medications that'll help promote bowel movement, like laxatives, stool softeners, and all that. Then there's diet modification, fluid management, stimulation techniques, pelvic floor exercises, intermittent and scheduled catheterization, timed voiding, enemas, bladder scans, follow-up and documentation of outcomes. So you see, it's purposeful, it is organized, it is structured, and it's purposeful. So that is what it means when you see because you see the big name and you wonder what are they talking about. It's just the same, regular things we do, but we do it in a different way. That's it. So that's it for this one. Thanks for listening. Make sure to like, subscribe, and follow for more.